Very good point. Thank you, Ruth. I was just going to ask about annual health checks, really, because of course it's been more in the political agenda, I would say, quite recently, and there has been a lot more raised awareness on annual health checks. Do you think there still needs to be more work done around annual health checks linked to learning disability nurses?
Yeah, I think so. I think in some areas in Wales, we've got what we call primary care liaison nurses. And those are nurses who are working directly with surgeries. And they might be doing things like making sure that the registers within the surgery are up to date. So the surgery knows who they should be inviting for annual health checks. But they also do work on supporting people to access, so whether that's about things like being confident enough to go for an appointment, making sure that people feel prepared for it, but also working perhaps with the other side, in terms of supporting the GPs and the practice staff to raise their awareness around learning disability, their awareness around communication and what they need to do in an annual health check. And I
Hmm.
think also one of the areas where there probably is a need for us still to do more is to follow up on the annual health check, because I think sometimes people can go for an annual health check and it's almost like, well, the box is ticked, but it's like, so what? But if things are identified, people sometimes need support after the annual health check to make sure that they can either take on board advice that was given or access what they need to do in order to help their health.